So the Lieutenant Governor and I want to use our regular 2 o'clock Tuesday press conference to provide Rhode Islanders with an update on the COVID-19 issues. So we are pleased to be here today with some familiar faces, with Dr. Nicole Alexander-Scott, Director of the Department of Health, and Tom McCarthy, Executive Director of the state's COVID-19 response. I'll make my comments, and then everyone will make their comments, and then we'll open it up to questions. So I want to say a special thank you to everybody who's covering this issue, in terms of not only for the last year, but also currently with the Delta variant being so much in the news, and certainly the people of Rhode Island want to make sure they hear what's going on. So thank you for the time to cover this in real time. So it's been a little bit of time between visits with both the doctor and Tom, but they've joined us here today. It's important for Rhode Island to know that our teams, our health teams, are in daily contact and are monitoring Rhode Island's numbers and looking at the data to make informed decisions to keep Rhode Islanders safe and healthy, and to keep our economy in the recovery mode. Right now, we know that our best tool to combat COVID and the Delta variant is vaccines. Let me say, and again, getting vaccinated is the #1 thing we can do to keep ourselves and those around us healthy and out of the hospital. And it's the #1 thing we can do to prevent COVID-related deaths. Yesterday, CNN reported that 99.1% of the people who are vaccinated are not going to be in the hospital, nor will they be, will we have to attend their funeral. So the vaccinations are the key, and that is why, if you haven't already, it is time to get vaccinated. It is time. And I'm going to, on the COVID numbers, let me just go through a couple of them, and then certainly the details, the doctor and Tom can kind of fill in the important details. So some of the updates of our vaccination progress and new vaccination policy for healthcare workers. Yesterday we reported 145 new cases. There was a lag in the data, and I'll share that. August 5th, there were 287. On the 6th, there were 227. On the 7th, there were 190. On the 8th, there were 117. Yesterday, there were 145 new cases. Our percent positivity yesterday, positive, was 3.2. We had 1 death and 6 additional people hospitalized as of yesterday. The 7-day hospitalization average, I don't think this is correct, so I'm not going to use that number. So, but I think the most important thing as being reported on the vaccination numbers, we are 5th and 6th in the country on first shots and second shots. Recently, we've had the lowest death rate in the country, and last week I think it was reported at 44. That means about 5 states were stronger than us. And our hospitalization rate was reported yesterday in the Providence Journal at 47. So there's only 3 states higher, that are stronger than us in the hospitalization rates per capita. So we're in a good spot, but that doesn't mean that we are not going to do everything we can to make sure that the people of the state of Rhode Island are safe. Safety is the top priority. And as I mentioned last week, our team is digging into the number of eligible Rhode Islanders who have not yet been vaccinated. For these individuals, my message is polite: it is time. It is time to get vaccinated. Every week, we're going to be counting that number down, looking at the demographics, and doing everything we can to reach those individuals who have not been vaccinated, to give them reasons to get vaccinated. Last Tuesday, we had more than 200, it was about 205,000 Rhode Islanders left to be vaccinated. Today, I'm glad to share that has dipped below the 200,000 mark, and as of this afternoon, there are 194,588 eligible Rhode Islanders 12 and over who have not yet been vaccinated. Right now, just over 80% of Rhode Islanders age 18 and over have received at least 1 shot. We are officially over the 80% milestone, And as you know, I set the goal of getting to 90% as our goal, and we're starting to move towards that. 80.6% of Rhode Islanders 18 and older are fully are vaccinated, and 73% of eligible Rhode Islanders are fully vaccinated. For the past 4 weeks, we have seen a slight increase in the number of people getting vaccinated, and that's good news, and we want to see more of it. I saw this firsthand at a pop-up clinic we hosted at Buckland Park in Providence last week. I know that the Education Department did a robocall into the families to get them prepared for the opening of school. As a result, and I introduced myself to many middle school students in Providence that were along the line, and so we had 135 people get vaccinated. That's encouraging, because that's just in like one area of Providence, and when you multiply that effort around the state of Rhode Island, you're going to see why we're going to be moving, more and more people vaccinated in the state of Rhode Island. And that particular clinic, we had 16 people registered, but when the word got out, and we thank the Providence Public School District, along with the Department of Education, folks were calling their friends, and while they waited, again, that line kept on growing, and I was very happy to be introducing myself to everybody along the line and thank them for coming out and getting vaccinated, so that not only we keep the adults safe, but we also have a focus now clearly on the 12 and oldest. Rhode Island vaccinations efforts are going strong, and we continue to be in the top 5 in the country for vaccinations. We know that in order to stay ahead of the Delta variant and keep Rhode Islanders out of the hospital, we must keep that going. Today, we are announcing a new policy to make Rhode Island's healthcare facilities even safer and to make our vaccination numbers stronger. I want to thank the Rhode Island's healthcare workers for their heroic efforts through the pandemic, and we want to ensure you are safe and protected at work. That's why all healthcare workers in state-licensed healthcare facilities, as defined in statute, will be required to get vaccinated by October 1st, 2021, except individuals with medical exceptions. Until October 1st, all healthcare workers and providers who are not fully vaccinated will continue to be required to wear a surgical mask while inside a healthcare facility, and will be required to be tested at least 2 times a week. This goes for both public and private facilities. Shifting gears on the vaccination, on the Rhode Island Gives Vax Challenge update, I also have an update on our Rhode Island Gives Vax Challenge incentive program hosted in partnership with the Rhode Island Foundation. As of the end of last week, we reached our 25,000 first dose goal in just over a month, and surpassed that day as more than 27,000 have received their first dose since the challenge began. For reference, we have launched this program. Our estimates showed that we wouldn't reach the 25,000 first dose milestone until October. So the vaccinations are accelerating at a rapid rate, and I'll announce the round 4 recipients today, and we'll hold a special event to announce the last round and to recognize all these remarkable community organizations for supporting our COVID response. The round 4 nonprofit recipients of $10,000 grants are, and I list them with a great deal of respect and ask people to be supporting these organizations because they have supported us. Last week we were at the Elijah Project to present a $10,000 check from the state, and then Friends of the Elijah Project that were in the Pawtucket area actually came with another $10,000 check. So we know that these nonprofits are so extremely important to our state. And in addition to that, it allows the story to stay alive that vaccinations are important, and it is time. Operation Stand Down, Rhode Island. The Boys and Girls Club of East Providence. Rhode Island for Community and Justice. Lucy's Hearth. Amenity Aid. Hope's Harvest, Rhode Island. Capital City Community Centers. Progresso Latino. Clinica Esperanza. Foster Forward, Central Falls Family Self-Sufficiency Foundation, Close to Kids Rhode Island, New Beginning, Interfaith Counseling Center, Macaulay Ministries, We Share Hope, Johnny Cake Center of Peacedale, and the Providence Rescue Mission. We're fortunate to have all of them, so thank you so much for those who volunteer and work at those organizations to provide services to the people who live in all our 39 cities and towns. School district community vaccine strategy. There's one more key to our statewide vaccination efforts, and I'd like to outline it today. My office, the Department of Health, to ensure a safe return to the classroom for every child, which will be happening in the next few weeks. If you have not already been vaccinated, please get your child vaccinated. If they are eligible, please get them vaccinated. With school just around the corner, it is time. A statewide effort is underway to connect every single school district in Rhode Island with a school-based or community-based vaccination clinic. Many of these have already been started, and your school district should be reaching out to you directly with details about your district and your school. As a reminder, per CDC guidance, the state is strongly recommending that districts create a policy that requires all students, faculty, and staff to wear a mask indoors in school settings at the beginning of the school year. Some of our young people do not meet age requirements to get vaccinated, and we have to use all tools available to us to keep them safe and to prevent in-classroom learning disruption. We don't need to have students being quarantined because of an infection in the school. They need to be in the classroom, and we're working with not only the Providence School District, but school districts around the state of Rhode Island, so we all understand that our students need to be in the classroom. They can't afford to lose more time, as last year occurred without any real way out of that, but at the same point in time, we don't need to repeat that. So we're going to use those remedies to make sure that our students are in the classrooms. Masks, as we've been saying, the vaccines are safe and they are very effective in preventing death and hospitalization. However, as we also been saying, the Delta variant is more contagious. And we are seeing that in the data, it is still possible to get COVID after you're vaccinated. Now, the vaccine will help prevent you from being hospitalized or dying, but there are still side effects. If you are one of the Rhode Islanders who does get COVID, even after you're vaccinated. Some of the side effects include you will feel sick and you may need to quarantine. If your child gets COVID, they will be out of school. Now, there are ways to help mitigate the risk of catching COVID, and we know they're effective. Now, before I say anything else, I want to say no one at this table is suggesting that the state impose a mask mandate again right now. What we are saying is you or your family need to know the risk of the Delta variant, and then, if you are vaccinated, make the decision that's best for you. If you want to wear a mask in public, wear a mask in public. Yesterday I was shopping with my daughter for hiking boots, and one of the stores I walked into asked me to put a mask on, and I did. So I carry a mask with me. The next store we actually bought the boots. There wasn't a requirement that was posted on the door, and we went in, and I didn't wear a mask while I was in that store. So it's going to be dependent on where you are, but I'm carrying a mask with me to accommodate those who feel as though it's necessary in their facilities. Be courteous and do as you're being asked to do. So what we are saying is you and your family need to know the risk of Delta variant. And then if you're vaccinated, make that decision that's best for you if you want to wear a mask in public. And this seems to be what Rhode Islanders are doing already. Like I said, I've seen it myself. Some folks were wearing a mask, some were not. They made the decision for themselves based on the comfort and weighing their risks. We will, of course, continue to monitor Rhode Island's numbers closely with the Department of Health, particularly in hospitalizations and deaths. So closing, I really can't say this enough. our campaign is going to be, it is time. And it is time to get vaccinated. Those who are unvaccinated, we ask you, please, get vaccinated. So that's our mission, and please do not, please do your part. Visit vaccinateri.org or call 844-930-1779 to sign up over the phone. So let's keep it going, and with that, I'll turn it over to Dr. Alexander Scott. Doctor?
Good afternoon. Thank you. And Lieutenant Governor, thank you for those updates. While I've not been here with you at the press conference for several weeks while our case numbers were lower, which makes sense, it's important to know that the public health professionals that work with Tom and I at the Rhode Island Department of Health have continued to monitor and respond to this pandemic 24/7. As we have for the last year and a half, the Rhode Island Department of Health will continue to give the state of Rhode Island 110%. Whether it's the testing program that we're leading in the nation in, or it's the vaccination program, our support with employers to help ensure that they have what they need to advance policies that will increase our vaccination and testing rates, or just engaging with the communities that we know are hardest hit. That's something that we take pride in and something that you can be absolutely certain that we're always going to ensure you have the latest data and information so that you're equipped to do what's needed. Along the lines of what the governor said, as most of you know, the Delta variant is the major focus for us right now. From a science standpoint, the Delta variant is much more aggressive than the other strains of coronavirus that cause COVID-19 that we've had in Rhode Island. Just to explain that a little bit more, while someone who had one of the earlier variants of coronavirus might infect one or two additional people, now with the Delta variant, that same one person could actually infect 6 or 7 other people and make them sick. Because of this heightened contagiousness and transmissibility, we estimate that more than 75% of our cases are likely now Delta variant cases, this much more aggressive and contagious form, which the vaccine works against. It's why we've seen more than a 200% increase in our case rate over the last few weeks. An important takeaway, though, is recognizing the strength of our high vaccination rates. Our hospitalization numbers have not risen as significantly as our case numbers. That's what we expected. Our fatality numbers, thankfully, have remained essentially flat. That's exactly what we want and what we've talked about since the beginning. Vaccination keeps you out of the hospital and keeps you alive. This is because, as Rhode Islanders, we are doing a great job getting vaccinated. Together, we have more work to do because we're always going to give it 110%, 70, 75%. That's not enough for us. We want to get as many people vaccinated as possible. There's no reason why in Rhode Island we can't get to 90, 95, or 100% vaccinated, and we want to use every tool we have to promote that. The key message for people today is that the vaccines we have help protect against serious illness from the Delta variant. That's the number one message you want for your loved ones, for your coworkers, for your friends. If you're watching this today, if you are reading about the Delta variant in the news and want to know what you can do to protect yourself and your loved ones, the answer is get vaccinated. It's time now. Everyone who is eligible, that means people 12 and older, should be vaccinated. There's no reason why in Rhode Island you cannot. You cannot count on quote-unquote natural immunity from a previous exposure to COVID-19 because we didn't have Delta variant then. So the natural immunity that you developed did not include antibodies against the Delta variant. That's only increased within the last few weeks. Your number one protection right now is getting vaccinated. There is more and more evidence suggesting that this particular coronavirus, SARS-CoV-2, does not confer long-term immunity after natural exposure. So we want you to hear the message. If you've had coronavirus in the past, relying on that alone as the immunity to naturally protect you from the Delta variant is insufficient. The vaccine is another critical layer to add to that. And as we have been saying, the vaccine works against the Delta variant. That is our greatest gift. When we say that the vaccines help protect against the Delta variant, that doesn't mean that it is impossible for you to get COVID-19 after getting vaccinated. But what it does mean is what we've been saying all along. The vaccines are extremely effective at keeping you out of the hospital and keeping you alive. That is our critical point, and it's what we want for everyone, for all of our loved ones, to stay out of the hospital and to stay alive. Because it is still possible for someone to get COVID-19 after being vaccinated, particularly with the Delta variant, as we have seen and understand, testing is also very important for everyone across the board. We're leading the nation in testing. We have been for over a year. Take advantage of those resources. If you were vaccinated but develop new symptoms, get tested, even if you think it's just allergies or a cold. Another important tool, which the governor touched on, is masking. Masks continue to work. Nothing has changed to limit the spread of COVID-19. As time has gone on, the science and the data are making that fact clearer and clearer. And as we've learned more about the Delta variant and how contagious it is, why not use one of the additional tools we have to help protect yourself and your loved ones? People who are vaccinated have the option to still wear a mask indoors in public places. That's important to know. This is something that I'm doing now. Given that our community transmission rates have risen so significantly, this is a personal choice that I am making for my health and the health of my family, including my son, who is too young to be vaccinated. It's our responsibility to encourage that for all of you. I said earlier that you'll always get 110% from us, Rhode Island Department of Health, from what's needed. We're going to continue to do that today and every day going forward in providing you with the science and the data. We continue to make sure our website remains updated with the latest, and we want to be there to help you process the information and empower you to make the decisions that work best for protecting yourself and the people that you love. We want to make sure that you are equipped with what's best for you and your family. I'll wrap up by saying that we have the tools that we need. We've consistently talked about those three major tools: vaccination, testing, and treatment. They continue to be what works, what we know is out there, and we should feel confident in where we are as a state and the team that we have in place to respond to this increase and help make sure that you are equipped with doing what's best to protect your families. We absolutely will get through this. With that, I'll pass it over to Tom McCarthy.
All right, great. Thanks. Good afternoon, everyone. Thank you, Governor Dr. Alexander Scott. So I'll provide just a quick update on where things stand on the operations side and highlight a few key focus areas for the next month or so here. So our number one priority right now is increasing vaccinations across the entire state. But we have a special emphasis on those communities that don't have vaccination rates where we want them to be right now. In those communities, we're partnering with local leaders, and folks on the ground to do whatever it takes to continue to get people vaccinated. And to highlight that effort, we'll be doing more than 60 pop-up vaccination clinics in the remaining weeks in August alone in places like Providence, Pawtucket, and Woonsocket. Schools and back to school are our other major focus area right now. We have had fantastic partners in the school community throughout the course of the pandemic, going all the way back to the opening of schools last year. And we're excited about continuing to partner to ensure that we can get as many students vaccinated as possible before school begins and ensure that we're providing a safe learning environment throughout the school year. So in close partnership, we're going to make sure that there is a vaccine clinic, a vaccination opportunity for every local education agency in the month of August, and then also again in September once school has started. This is something we've done in the past. As you remember, we did it last spring, and we anticipate also offering this opportunity once vaccines are approved for those 11 and younger. Now, parents, you don't have to wait for that. We have thousands of appointments available every day, but we'll have those clinics specifically set up in your local community. In addition to our close collaboration with schools on the vaccination front, we're also working closely to ensure we continue to have a robust testing program on site in place as we did last year. And as the director shared, testing is incredibly important still. And we have a lot of momentum to build on in this area. As the governor and the director had shared, we're at the top in the nation when it comes to testing per capita. And our testing infrastructure is prepared and well positioned to absorb anything that we might see in the fall here as our case numbers have increased. All schools will have the opportunity to provide on-site testing. We'll also continue to have that dedicated school testing network across the state, and we're going to continue to have that in the community presence for our testing program. An example of that is we're going to have a pop-up testing opportunity at the Mount Hope Neighborhood Association in Providence this afternoon, and we'll be out in Central Falls and Pawtucket tomorrow. Now, this is on top of our network of testing sites through primary care providers, pharmacies, respiratory clinics, and our state-run sites. And for more information to make an appointment, go to covid.ri.gov/testing. The last thing I want to highlight today, another key piece of our response strategy, is our partnership with employers throughout Rhode Island. Now, we're going to be working closely with healthcare facilities throughout the state to help make sure that they can meet the requirement that the governor outlined of having every healthcare worker in the state fully vaccinated by October 1st. And any other employer who's looking for support in getting their vaccination rates among employees as high as possible by either providing on-site clinics or working through policies that you can implement with your employees, you can go to covid.ri.gov/public and then click on the Community Partner Interest Form. Once you've provided us with your information, we'll reach back out to you to discuss how we can best support you. Similarly, we're also working with employers to offer regular testing for their workers. If you're interested in getting started with this program to set up for your work site, write to rido.covid19biztesting@health.ri.gov, and that's biz spelled B-I-Z. Our COVID-19 testing program for businesses is a great way for employers to reduce the spread of COVID-19 in the workplace, minimize disruptions to productivity and staffing, and bring peace of mind to employees, clients, and customers. Now with that, we'll open it up for questions.
Thank you all. Just a reminder, Lexi and I have the microphones, and just keep the questions COVID-related, please. Lexi?
Governor, the CDC recommends that fully vaccinated people wear a mask in public indoor settings if they're in an area of substantial or high transmission. Providence County, where we are now, is one such area. Even personally, why are you deciding not to wear a mask today despite the CDC?
No, I think with today's announcement, what you just heard, that we'll be wearing masks in this State House, and then we'll be asking people in the state of Rhode Island that work for the state of Rhode Island to wear a mask indoors.
So you recommend that people, even if they're fully vaccinated, wear masks?
We're going to follow what Dr. Alexander Scott just laid out, and as a result of today's announcement, that's why I've got a mask here, we'll be asking I'll be talking to our Chief of Staff, Tony Silva. I talked to him before I came over in terms of how we're going to relay that message, but the message is going to be that if you work for the state, that you'll be wearing a mask.
And are you still considering considering at all a mandate, vaccination mandate for state workers in general, not just health?
We're in discussions with the different, union representatives right now.
All right, over here.
Dr. Alexander, thank you. Dr. Alexander Scott, good afternoon. The Rhode Island chapter of the American Academy of Pediatrics wrote a letter to every superintendent in the state basically saying that they should implement a mask mandate for all students 12 and under. Your thoughts?
Well, we very much appreciate the leadership and partnership of our Rhode Island AAP colleagues. From a public health perspective, it's always important to make sure that every entity, all employers, institutions, have at their fingertips what is going to work best in protecting their staff, the families that are engaging with them. We know what the CDC has recommended. We're here ensuring that everyone is equipped with that information, and we appreciate our Rhode Island AAP colleagues helping to ensure that the school community has that as well.
There are some districts that have already said, or at least considering, that they'll just not implement any kind of mask mandate even for students 12 and under. What's your message to them?
Just really having the information to understand how valuable masks can be. We're talking about the Delta variant. We're talking about a population of children who cannot be vaccinated, and the understanding that masks are another layer that will help us in curbing the spread. We want to support school communities and how they implement it, but it's important from our standpoint to make sure they have the information and understand why it's valuable, and that the parents and members of the school community have that information as well and can help engage with Rhode and the school community leadership to get what's best for them and for their families.
Great, we're going to go over here next. Dr. Alexander Scott, can you talk a little bit about what you are seeing in terms of pediatric cases, what you are hearing from your colleagues in the emergency department? Are we seeing more children getting sick with the Delta variant, and especially children under 11?
Thank you for that. We know what's happening nationally, where there are starting to be increases in younger individuals. What it really points to is populations that are not vaccinated. And so it allows us to reinforce for all those 12 and older, you have the tool, go ahead and get vaccinated. And then also reinforces for those younger than 12 who are not yet eligible for vaccination, the value of having the other mitigation steps in place to keep them protected. We're still early on in terms of seeing the data locally in Rhode Island regarding hospitalizations and children, but we don't want to wait for that. We know what can work. We want to support parents, families, school communities, everyone in having the tools they need to make the right decision for themselves.
Do you know if there are any babies or toddlers or young children hospitalized because of COVID?
I would have to get back to you on what the census looks like right at this moment, but it's still early on before we're seeing. And, we are a well-vaccinated state. It's why we want to really continue to push amongst the people who are eligible for vaccination. That is a critical tool to help ensure that our children stay protected.
Thank you. Back here.
Governor, good afternoon. You said a couple of weeks ago that you weren't ready to pull an alarm unless there was a fire. Hospitalizations down, percentage testing positive, relatively good. What numbers would alarm you enough to pull a fire?
Well, again, to me, it's always been about the hospitalizations and the death rate. And so, that, as Dr. Alexander Scott says, it's stable, and we're going to do everything we can to keep it stable, and we'll react to the situation, and we'll follow the health department's lead on issues as we're doing today.
And just as a follow-up to Bill's question, why no mandate, if you feel that strongly, to schools? Because what we're hearing from the communities is there's parents groups meeting, they're putting pressure on their school committees. They feel that the mask wearing for kids is going to be onerous this fall. The superintendents have said, look, if the state feels strongly enough, do a mandate. Look, they take the path of least resistance. You start talking about liability, and they're all worried. But you're stepping up to the cliff, but you're not going over it. Why are you not telling them Why are you not mandating rather than strongly suggesting?
Well,
What would you say to those superintendents right now? I'm a superintendent, I'm not going to have a mask policy. What would you say to them?
I would expect the superintendents to follow the CDC guidance.
Which means they should be wearing masks.
They should be following the CDC guidance. That's what we strongly
So
recommended
then
a
why
few weeks
doesn't the
back.
state just mandate it and take that onus off of them?
Well, I'm not sure that, we may have to huddle with the health department. If what we're doing with the vaccinations on the mandate and the healthcare workers is going to come out of the health department in terms of their, you know, their role in terms of, in terms of meeting a health issue. So you'd have to kind of make that determination. We may have the authority in the governor's office to do another mandate, but we may not. And, but we know the health department does if it rises to a level of critical nature in terms of a health issue. So we'll review that. I'm sure that the health department will be reviewing that.
Hi, Governor. Do you support mandatory vaccinations among teachers?
No. We made, but I'd be interested in seeing what the president of the AFT is talking about in terms of engaging in that conversation. But one of the things that we did at a point in time when it was not, 100% popular, but we have our teachers vaccinated at 90% in the state of Rhode Island. We have the working staff in our schools at 90%. And we also have the child care and the child care workers. They've reached the level that we're looking for on a statewide level, which is 90%. So we'll continue, everything is under consideration, but the teachers have already stepped up and got vaccinated, right? They took advantage of the vaccinations. Now what we want to see is the student population do this to follow the teacher's lead.
Also, do you plan on opening any closed testing sites or expanding testing? And do you expect there to be a booster campaign? And who will that include?
Yeah, I'll let Tom handle that.
We do. So we've been monitoring the demand daily over the last several weeks, and we know, what the requirement was going back to the peak of our cases in the wintertime. So I would anticipate, we're going to open up some additional testing sites, because one of the things we want to make sure too is not just enough appointments available statewide, but enough appointments available that are easily accessible. So we're actually expanding some of our capacity beginning tomorrow. We'll be able to have about just over 5,000 appointments a day at state testing sites on top of pharmacies and others. And we want to make sure that we can control everything we can for the start of school, and one of those is our testing capacity. So we'll make sure that's as easy and seamless as possible. So we'll continue to build that up. With regards to boosters, we've been planning from day one, to be prepared to administer booster doses. So we have several plans already prepared based on whatever guidance we might get from the FDA. We've been watching what they have been doing internationally. I'd say we're prepared to administer a booster if it's decided that it's needed to every single Rhode Islander.
Okay. And lastly, Dr. Nicole Alexander-Scott, we haven't seen you at these press briefings for quite some time now. Do you think that was a responsible approach considering the state that Rhode Island is in, and why did you decide to do that?
So thank you for that question. From a public health perspective, it's always important to get the message out and to make sure that people are informed, have the data and understanding of the science that's there. This is one of many ways to do that, and we can guarantee, as I've said, we are always going to ensure we are accessing every mechanism possible for people to have the information that they need. So if there's a desire to have it more through this route, that's something that we are ready for. Being able to put the message out online, radio, other mechanisms, we want to use whatever will work to ensure people understand the seriousness of the Delta variant, know the value of getting vaccinated if you are eligible, and how that can help protect the children as we're reopening schools safely, as well as preserve our economy that has opened well. And we'll keep doing whatever it takes to get that message out and make sure everyone has the information they need.
Thank you, right here.
Yes. Dr. Alexander Scott, you talked about the Department of Health working at 110% levels. I've heard from a number of people that the people are approaching burnout, and there's not enough support, emotional support, for the type of efforts that's being done. I was wondering what type of state resources are available to support the frontline health workers and also the people at the Department of Health in terms of their enormous efforts to work on this coronavirus pandemic.
Yeah, it's a great question. Particularly, our colleagues at the health department are my heroes, with what they have done, what they have sacrificed for their families and otherwise, and how they continue to move forward in spite of being tired or, just having exhausted many hours and days or skipped vacation or whatever it has taken to make sure that Rhode Islanders are healthy and safe. And it continues to remain a top priority for us to understand what other resources are there. We're learning, every day how this has impacted frontline workers across the board and determining what types of tools there can be in place to provide the emotional support, the encouragement, the appreciation for what our staff have done, and so many others throughout this response. So it's a top priority, and it's one we'll continue to focus on for quite some time.
Governor, you talked about an October 1st mandate for people, healthcare workers, who are working in state licensed facilities to be vaccinated. How do you define state license? I'm assuming it's state hospitals. Does that include group homes, and what else?
Yeah, nursing homes. We've met with the nursing homes. They're expecting this. You had Genesis that actually came out last week as a national group talking about mandating their staff get vaccinated. So, yeah, it's any health organization that's licensed by the state of Rhode Island.
So that includes the state hospitals?
Yes.
What happens if people are not vaccinated by October 1? Do they still have employment?
Yeah, well, we'll deal with that if in fact that happens. I'm not expecting that's going to happen. The comments that I'm receiving from people are supportive of that nature. And I would say, too, is that, look, that's an area we need to pay close attention to. And we are. Our cumulative numbers may not look all that strong when you take it, from the beginning of the pandemic to now on death rates and hospitalization rates, which gets continually reported. But that's not the snapshot that we have right now. So we want to keep it that way, and we're going to do everything we can to keep it that way. And clearly, we do not, we know that there are some staff members that are unvaccinated, and inside of our hospitals, the congregate cares, our nursing homes, we're going to mandate that because we know that that's an area that is at a risk, and we don't want to take any risks.
Thank you.
Thank you. Right back here.
Yes, I have a question for Dr. Scott and then Governor McKee. Dr. Scott, there was a recent story in the New York Times that said, regardless of section of the country, there's 15% of the population that won't get vaccinated. That number has not budged. So are you giving a false hope? Just a short time ago, you said, Rhode Island, let's get to 90, 95%. That defies national averages of studies that, for different reasons, religious, whatever it may be, there's 15% of the population that will not get vaccinated, and it doesn't seem to be a matter that whether it be you or a politician is going to convince them.
It's always our responsibility to strive for the best. This is not the first time that there has been a public health need, whether it's seatbelts or smoking or otherwise, where our number one focus is always going to be to achieve the goal that's going to keep as many people safe as possible. What we are seeing nationally and what we are staying ahead in now is helping to put policies in place that allow for the path of least resistance to be getting vaccinated. That can help cut down on that 15% number. And with Rhode Islanders, we have always led the nation in immunizations, from children through to adults. There's no reason why we can't achieve what we've put forward. New York Times is referring to the nation as a whole. They didn't have in mind what Rhode Island has accomplished over the years and what we know we can do if we work towards it together.
And Governor McKee, there was a recent television story, I think it said either 30 or 40% of firefighters in Providence are not vaccinated. As governor, would you consider some kind of a mandate, all first responders should be vaccinated by a certain date?
Well, yes, I would consider it. Would I do it? I'm not sure we're going to go that route, but we're considering all the options right now. And to your issue of, can we get to 90%? I see I'm pretty good with numbers, and there's a path there to 90%, especially now the universities are going to fully vaccinate. All students come in. That's almost 62,000 people are going to get vaccinated. In the 18 and older, we're over 80% right now. I was talking to my friend up in Vermont, the governor up there. He's approaching 85%. There's a path, and it is time, and that's what our theme is going to be. It is time. And the other piece that's going to really move this issue, I believe, is when Pfizer gets the FDA approval. That's going to be a real game changer for many, many people who are seriously saying that they didn't want to get vaccinated until there was FDA approval. That's going to happen in the next few weeks. And so we're preparing for that right now to make sure that it's really well known inside of that dwindling number at 195,000 that the FDA approval is coming now. It's coming. So we know it's coming. They're not announcing that it's coming if it's not coming. It's coming. So that's going to be an FDA-approved vaccine. I would expect the other vaccines will follow shortly after that. So that's going to really bump up the numbers quite a bit. There's many people who are, pausing because of the lack of the FDA approval. That when that comes in, our numbers are going to bounce pretty significantly.
We have time for 2 more questions.
Governor, you had until very recently been resistant to any kind of vaccine mandate. What has changed your opinion where you just said you're considering options for other sectors and to then require it for healthcare workers?
Well, I think in the healthcare area, after meeting with the nursing home owners and talking it through with them and understanding that they're going to support it, and also I think that the hospitals recently talked about a September 1st, right, and it was at Care New England, right, and so I think all in, it makes sense to do it, and so we're doing it. We know that, and we also know that our numbers are, significantly high in the population that it would be in nursing homes. So we're confident that that with the right precautions that we're not going to put our nursing home people at risk. Remember that 80 and older was a number one death rate of the 2,700. And remember, this is the other piece I would say too here. So on the year anniversary, which was a day before I was sworn in, we reached 2,500 deaths in the state of Rhode Island. 5 months later, again, every life matters, right? But we haven't got to 2,800 yet. So we're on a pace that's significantly less than where we were at the pace when I was sworn in. So we're going to do everything we can to keep people safe. And I think working with the Department of Health and working with the nursing homes and the hospitals, we believe that that's an appropriate measure to take, and to mandate the staff people that work in the facilities that take care of the people who are in that age group in particular, that they get vaccinated.
How close are you to a mandate for state workers in general on vaccines?
On a 1 to 10, maybe a 5. But the conversation's still going on.
Dr. Alexander Scott, since we haven't seen you in a while, I know the governor again has been resistant to reimposing mask mandates, going back on restrictions. From a public health perspective, do you agree with that? At this point, do you think people are tired of any mask mandates, and that's why the approach is to strongly recommend as you're wearing a mask?
Well, we like to align with what the CDC recommends, and they came out with the recommendation, probably taking into account some of what you just shared. And we want to just continue to make sure everyone has the information at their fingertips of what's critical, what's going to make a difference in protecting their families, protecting their loved ones. So continuing forward with that recommendation, it's been an approach that has worked well for us overall, through the years, making sure people are informed, educated, and equipped to make the right decisions. And so we want to continue to align with that.
From a public health perspective, would it be more helpful to reimpose a mask mandate? Would that cut the numbers?
What is key is making sure as many people are vaccinated as possible. The masking piece is a next layer of protection. The primary one is masking. And so the work that we're doing with employers to help them in supporting policies that really advance that for their staff and for the patrons that they have and care for is a key. And then having the subsequent mitigation steps that we know are also effective, and making sure that people are educated on how successful they can be in reinforcing what we want to be done with vaccination, masking, distancing, ventilation being strong, helping to ensure hand washing, all of the steps that can work are put in place wherever possible.
Thank you. Last question back here.
Thank you. Dr. Alexander Scott, how confident are you in the early warning system we have in place in Rhode Island for genomic testing to detect variants as they arise? And I understand, of course, we only have the resources to test a very small sample for genomic sequencing. But I assume, going by the experience of other states and nationally, when we estimate, say, what is the prevalence of Lambda, of Delta in the state, but then we don't know, say, what's the prevalence of Lambda. And how long do you think the lead time will be? Is it going to be 2 weeks, 4 weeks, 8 weeks before we know where we stand if we start to get into a problem like that?
Well, we know for sure that the Delta variant is continuing to be predominant. In terms of the confidence, we have the same Rhode State Health Laboratory that really was our lead in initiating the response to COVID here in Rhode Island. That same leadership has worked in building from scratch our genomic sequencing program here in Rhode Island. And they have done a phenomenal job under the leadership of Dr. Eva King since the beginning and even now. As our Rhode State Health Laboratories, we have expanded the program to the point of being able to test any specimen that we're able to access to assess for genomic sequencing. So we are among the better states in understanding what our data is showing and having our internal capacity for doing it and the quickest turnaround time that we can build, while also partnering with our academic partners, our state neighbors, and others. We will continue to do whatever it takes to ensure we have the data and the information and can relay that to Rhode Islanders so that you can be confident in making the decisions that are best for your families.
What percentage of positive test samples are genomically sequenced in Rhode Island?
We can get the exact data, but we are looking to have that done for every specimen that we can genomically sequence at this point. So it's not every test that's done, but once we have the specimen, we have built out the program so that we can test everyone that we have for genomic sequencing.
All right. Thank you all so much. Thank you.